Okay, so if you or anyone you know is struggling with major depression, major depressive disorder, and you or they haven't responded to antidepressants and psychotherapy, which are kind of the first line treatments for that disorder, and if nothing else seems to be working, your doctor might recommend, or you might want to ask your doctor about electroconvulsive therapy. So it sounds pretty scary, and the goal of it sounds even scarier, which is basically to induce a seizure in your brain. So that probably sounds pretty weird, and you might not know what a seizure is, but now that you understand an action potential, all a seizure is basically a synchronized wave of action potentials moving across the brain. So that seems like it might not do anything for depression. It would just give you a seizure and then return you to your normal state, right? But what scientists found is that more often than not, people respond very well, although the relief that they experience is often short-lived. So scientists really aren't certain about the mechanism that is allowing this to work and why some people's brains respond to it and why others don't. But you can kind of think of it like it's sort of like a reset of your brain in some ways. It's just this wave of activity that just flashes through the brain, and perhaps there's some circuits that needed to be activated to allow a depressed person to feel better. And so maybe for some people that's just what they need, and maybe it doesn't last forever because those circuits go back into a more quiescent state. This is all speculation, but the fact is that electroconvulsive therapy does work for very severe cases of depression. And of course, never try shocking your brain on your own, no matter how depressed you are. Talk to your doctor about this kind of thing. It is really only suitable for a small number of people. So just be aware of that. But it is kind of a last-ditch effort that can help some people. There are other forms of electroconvulsive therapy that don't involve just placing electrodes on the scalp and pulsing electricity through the brain. There are others that use transcranial magnetic stimulation, which is basically using oscillating magnetic fields directed at specific areas of the brain instead of an electrical current, but the idea is the same, to induce action potentials or to suppress them in certain areas of the brain. So that is kind of the basics of how electroconvulsive therapy works.